In this video, we'll identify patients that are over the age of 40 that have not had a fasting glucose or an HbA1c test done in the last 5 years and therefore are due for diabetic screening lab tests. So we'll start with our basic panel search. So you see here we have all patients that are attached to Dr. McCaffrey, whose status is active and whose status has been verified within the last 3 years. So we'll add to that, we'll go to add line, demographics, and we want all patients that are over 40 years old, 40 and over. So we'll do greater than or equal to 40. Okay? Next, we're going to add line and select our lab data. So we'll go to lab values and we'll scroll down first to fasting blood sugar. So that's right here. Go to months since latest. It's greater than or equal to, we want 60. So 60 months is equivalent to 5 years. Let's do OK. We'll add a line. And we'll also look at another lab value for hemoglobin A1C, because if a patient has had either of those tests done, they qualify. So we're looking for patients that haven't had either test and are due for screening of some sort. Okay, so we do hemoglobin A1C. Again, we do months since latest, greater than or equal to 60. But here, we want this to be or. We actually are going to indent this line. And that way, the logic will read as all of the patients require everything that's at the base level here. So all patients are attached to this physician, their status is active, and their age is greater than 40, and they have either this blood test or this blood test, and over 5 years ago. So you want to make sure that this is indented. You can only indent or outdent when you have the and or selected, and you want this to be an or so that both of these are included. Because if you were to select and, then you would only grab the patients that have had both tests done, or you'd be looking for patients that would be due because they'd require both tests done. Now that you finish that, you can click Perform Search and grab all of your patients that are due for diabetic screening.